You are listening to the Horse Radio Network, part of the Equine Network family.
Hello and welcome to this episode of the Disease Du Jour podcast. I'm your host, Carly Sisson, and in this episode I spoke to Dr. Travis Tull about cervical nerve root compression and a technique for treating it called arthroscopic intervertebral foraminotomy, which he has helped pioneer in the United States. This episode of Disease Du Jour is brought to you by Equithrive. Dr. Tull is an owner and surgeon at Ocala Equine Hospital in Ocala, Florida. He is a graduate of the University of Georgia College of Veterinary Medicine. He completed an internship and surgical residency at Road and Riddle Equine Hospital. Following his time in Lexington, he was a surgeon at Brown Equine Hospital in Pennsylvania before accepting the position as a surgeon and hospital clinician at Road and Riddle Equine Hospital in Saratoga from 2013 until 2017. His professional interests are orthopedics, soft tissue surgery, and lameness in performance horses. Thank you, Dr. Tull, for joining us today.
Oh, my pleasure, Carly. Appreciate you having me on.
Yeah, I'm really excited to talk to you about this. Can you give us a brief overview of what cervical nerve root compression is?
Yeah, so cervical nerve root compression, also referred to as in people cervical radiculopathy, it's interchangeable probably with intervertebral foraminal stenosis, is basically when the opening to the spinal cord that the nerve root goes through, which carries all the information to and from the spinal cord to the rest of the body, gets impinged or smaller, and so that nerve can get inflammation or damage or squished or constricted, and then that causes pain and some neurologic dysfunction as well.
Are there any known risk factors for the condition? Is it something that genetics and breed play a role in, or discipline possibly?
I think the biggest risk is being a horse, particularly if it's a really nice horse that the owners love. That seems to go hand in hand, but there's not any known specific genetic risks or variables. And we've seen it in horses of all different vocations. So we've seen it in thoroughbreds, race horses. We've seen it in English sport horses, Western performance horses, saddlebreds, Arabs, gaited horses. So there's not really a predisposition or one breed that I think stands out more than others or that's related to a specific genetic component. There is some research going on about that, but it's nothing conclusive at this point.
Okay, interesting. And how commonly do you typically encounter this?
Well, I would say not very commonly at all, because we didn't know it existed until about probably 4 or 5 years ago. Consistently, there have been some reports in the literature back in the 90s describing it, but until we got technology and imaging to a point that we could really look at this area more closely, it was very difficult to diagnose. So with a few things, advent of digital radiography and portable units that could generate enough power to get through all the muscle mass in the caudal neck of the horse, as well as three-dimensional imaging, really changed our ability to look at this and diagnose it.
Okay, interesting. So now that we know a little bit more about cervical nerve root compression, what are some common clinical signs that are associated with it that you think veterinarians should watch out for?
So they're like a lot of complicated problems which seem to revolve around horses. They can look like anything. So there are a lot of different signs that we see. And so one of the ones that I think are easier to point towards a cervical radiculopathy is a lameness, particularly a forelimb lameness, that cannot be blocked out through diagnostic nerve blocking. So the horse might be lame on their right front, your vet comes out, does all the imaging, goes through and does diagnostic nerve blocks, and goes all the way up the leg and cannot get the horse more sound. And that starts to point us more towards a problem with the cervical spine and cervical pain. So that's one of the things that we see. Common other things are behavioral problems. A seasoned horse that all of a sudden starts balking at jumps or starts bucking or taking off. That's very common. Horses that all of a sudden refuse to go forward. Horses that turn their head to one side when they're in work. Horses that will back up all of a sudden for no reason under saddle. And so unfortunately, a lot of these signs overlap with many other things that we see, whether it's back pain, hock lameness, SI pain, all of these things can overlap. And so it really is, cervical pain is almost a diagnosis of exclusion in that we're trying to rule out all the other things that could be causing it. And then to get all the way to a nerve root problem takes a while. The first thing I have to say is, does the horse have cervical pain that's causing some of these other signs? And then we have to go through all the steps to try and prove that. And what I'll show you here, this is a cervical spine of a horse. So the head would be over here on this side, and then the back would be over here. What we're talking about is this little opening, which is right in here, which is where the nerve root comes out. And it's on either side of this. It's called the articular process joints, which are these two joints that go on either side of the vertebrae. And so when these joints get enlarged for various reasons, that's when you can have impingement on the spinal nerve.
Right.
And so all these clinical signs, then once you kind of decide, okay, I think the horse has neck pain, then you have to go through a lot of the imaging steps to try and find it. And imaging wise, most people start off with cervical radiographs, which makes sense. It's something you do standing with minimal sedation. The problem is you can generally say from a cervical film, if it looks like there's some abnormalities there, but you don't know exactly what they are or what they're affecting just based on the radiographs, which makes it very tricky. And then once you have an idea that it could be that, then we use three-dimensional imaging to further get closer to what it is. And the next thing we do is computed tomography or CT, which is something that most large equine practices now have available, which is very beneficial on multiple different levels. So.
Right. Do you find that you can reach a definitive diagnosis with CT, or is it still sort of that diagnosis of exclusion even when you go into those more advanced imaging techniques?
That's a great question. So the problem with CT is it's very good for bone detail. It's not very good for soft tissue detail, and the nerve is soft tissue. The other thing that makes it difficult is the cervical spinal nerve is what we call extradural, which means it's outside of the protective lining that covers the spinal cord. So we can do what's called a myelogram, and we can put contrast material into that sac that surrounds, protects the spinal cord, and then see if there's something pushing on that. But it doesn't show us where the nerve is because it's outside of that. And so we're basically looking at the intervertebral foramen where the nerve comes out and trying to make a determination of, is that space smaller, and then correlate that to the clinical signs of the horse. There's not really an objective way to look at the nerve right now. In humans, they use MRI because you will actually see the nerve with MRI and can make at least some determinations of if there's physical damage to the nerve, which sometimes it doesn't show that. It can have physiologic damage, but not a physical change. But in horses, there's not really an MRI that's big enough to do their entire neck at this stage. And so we're relying on the CT to tell us what the space surrounding the nerve looks like. You know, we're looking at some different things about that, or different parameters, and people, they also look at the amount of fat that's coming out of that intervertebral foramen, and based on if the fat looks compressed or absent, you could say, draw the conclusion, at least in humans, that there's some impingement or some narrowing of the area. So Dr. Werpy, our radiologist, who I work on all these cases very closely with, is looking at that as well to say, okay, we're just making a note of all these horses that we see, is how many of them do they have this decreased fat coming out in space, which we can see on the CT, or at least a little more clearly than the nerve, and see if there's any correlation. And so we're trying to find some of those objective ways. Other ways that I think have some promise but are still a little ways out is doing electrical testing, stimulation testing of the nerve roots themselves. And so there are some modalities that you can use electrical signals to try and determine if the nerve root in question is functioning normally or not. And they do use that in people as well. It's in humans, it's got some problems because if it's very early on in the process, it will find them sometimes. It's too early.
Okay. Makes sense.
But in horses, most of the time, by the time we've eliminated everything else, we're kind of moving on to a more stage where I think we'd have less chance of missing those. But that's still very early stages of looking at those sort of things too, with some of the equine neurologists around the country.
Yeah, it'll be interesting to see how that progresses in the future. And of course, I'm sure all of this is so limited too by the owner's resources and their location and how able they are to get to a veterinary hospital, which complicates things as well.
Correct. Yeah, it does make it hard. And it's, doing all these diagnostics and going through an entire lameness exam and radiographs of the limbs and ultrasound of the limbs and radiographs of the neck, all those things add up. And so it becomes quite expensive to diagnose them, and then it's not inexpensive to treat them either.
This episode of Disease Du Jour is sponsored by Equithrive. Brought to you by Equithrive, the leaders in resveratrol science, Medicare is a new pelleted daily supplement offering metabolic support for easy keepers. Medicare is formulated by Pat Lawless, PhD, to support optimum carbohydrate and fat metabolism, healthy body weight, and appropriate insulin levels in horses, thanks to a proprietary combination of resveratrol, flavonoids, and amino acids. Learn more at www.equithrive.com. Well, moving into treatment options, one of the reasons I wanted to have you on the podcast is because I know that you've helped pioneer a technique for treating this condition in the United States. So could you talk a little bit about what that technique is and how successful you've found it?
Yes, it's actually something that we've done quite a bit here at our practice, and I'm pretty proud of the fact that we've been able to bring this and integrate it into our practice, and then also share it with other veterinarians. And Dr. Janheim Swegemakers from Germany was the one that first started looking at this particular technique, and he actually became interested in it after his father-in-law received endoscopic foraminotomy in Belgium, and he was invited to go watch the procedure and thought it was amazing. And
Oh, wow.
went back to Germany, and he happened to have one of the first CTs that you could fit horses in at his practice, and so he began looking and was disappointed because horses don't have nearly as many lumbar problems as humans do, but did find that, hey, maybe this is something that we could use in the neck in horses. And so that's kind of how he became interested. He started researching and working to develop that. And here at our practice, we recently, the last several years, obtained one of these same CTs and started seeing more and more horses with this problem. And currently, at the time, there was only medical treatments, which would be trying to alleviate the inflammation or pain through injecting the articular process joints with corticosteroids or biologic products or lubricating products, the actual joint, and then also putting steroid around the nerve root, which we call like a nerve root injection or cervical spinal nerve injection, to just limit the inflammation, which does help horses with mild cases, but there was no real fix until this came along. And so what it's called is percutaneous endoscopic foraminotomy. And that's kind of a mouthful, but it uses a specialized scope. We use the scope manufactured by Richard Wolf Spine, the company that developed it in humans. This is the actual endoscope right here.
Oh, cool.
So it's pretty long, as you can see. And this is the viewing piece, or the actual scope that a camera hooks up to, then projects the image on the screen. And this end of the scope, if I can get it into focus here, has a camera that's angled on the end, but it's got a channel that you can work through. So right here, so the scope will actually go into the horse's neck right along the foramen. We use ultrasound guidance as well as radiographic guidance or fluoroscopic guidance to get the scope right alongside the foramen. And then we can put instruments through this and work right through the scope. And so we end up with a small incision. It's about 1.5 inches long, several centimeters long. And we use different hand tools and a hand piece that has a burring attachment. And we basically shave all the bone like on this specimen. So if we were working in this foramen right here, this opening, and we said, well, there's too much bone here on the bottom, and that's pinching the nerve, then we would place this scope right down along and work right there and remove some of this excess bone, and create a larger opening. And the idea being that the spinal nerve would not be impinged or crushed. And the other thing that we found out through different research that other groups have been doing is that when the horse, their neck is an extension, meaning the back part of their neck is extended, it actually reduces that intervertebral foramen by 40% from normal. And that's in a normal horse. So if you have a horse that has a reduced foramen to begin with, and they're going to lose 40% of that space, then that could certainly cause problems. The other thing that we found out in our practice, along with Dr. Werpy, we developed a technique to do myelograms, which we kind of mentioned before, and we actually flex and extend their neck to look for dynamic problems inside the CT because our CT is big enough. And before, we could only do the CT of the neck in kind of a neutral position until the CTs got big enough. And so we've been able to find some changes that happens around that foramen just from the flexion and extension that has helped us look at that a little closer. And one of the other things we found out pretty quickly is that when you have a horse in pole flexion, which a lot of vocations need to have, it actually puts the back of the neck in extension. And so we see a lot of horses, it seems counterintuitive, but as their nose goes down, the back part of their neck goes up. And so it actually puts that in extension. And so we see a lot of horses that have problems when they're put in extreme flexion because the actual back of their neck's an extension, and that's where it gets more narrow, and that's where most of them have problems.
Right. Yeah, that makes a lot of sense.
And that's a common complaint is, behavior changes, lameness, or things like that in response to head position. And so we hear that a lot as well.
Right. So how successful have you been with this procedure and returning horses to work, and what does the long-term prognosis look like for some of these horses?
Yeah, so that's a great question. We've been very pleased with how horses respond. And, my experience has been very similar to Dr. Swagemaker's, and he's got over 300 cases that he's done in Germany. We've done 74 surgeries here, 51 horses. So obviously some horses had more than one site. And our outcomes have been very similar to his, which is 80% of the horses will improve their clinical signs, whatever that may have been, because it's so varied.
Right.
It's a little harder to judge who goes back to the exact same level of work. And some of that's dictated, I've had owners that are like, well, this horse is supposed to be a Grand Prix horse. It had never gotten to there. And we did surgery and the horse improved, and they were able to do some of the behaviors went away and they're able to go back into work, but they never quite achieved that. So if you ask them on a survey, did the horse get back to its original work? The answer is, well, not really. So it's really hard to judge objectively. But I think this is one of the few surgeries I've been involved with where most people tell me they notice things about the horse pretty soon after surgery that they never thought of as a problem, but then they realized, hey, this is, my horse is eating its hay off the ground really well. And it used to hate to do that. We had to hang the bag. It's never done. And sometimes they'll say it's 2 or 3 days before or after surgery. I've had people say, I just thought he was always food aggressive because every time I came around the stall, my horse would pin his ears and look grumpy and act fussy. It's completely gone after surgery. And we've had some horses where people called me and said, I've had this horse out at my farm for 4 months before he did surgery, never laid down once, was always nervous in the stall and kind of pacing around. And the horse got home from surgery and 2 days later laid down, took a nap, and acts like a different horse. So I think there are some subjective observations that people have about the level of comfort that I feel like it does help the horses. So I tell people I think that we'll make them feel better. I don't know that we'll get them all to what they're supposed to do. And at this stage of the game too, whenever you have a new surgery that's just getting started, that's, this, I think Jan Heim's first surgery was in 2020. The first one we did was in 2023. Until you get years and years out in multiple numbers, it's very difficult to say. And a lot of times you get horses that have multiple abnormalities in their neck. And I see several of these where they've got, stenosis on a CT and, C3 through C7. And so that's a lot to ask. We don't know for sure, but it stands to reason if they have more sites, the more likely they're not going to do as well. And people have said, well, we just want to make them more comfortable. And some of those horses have actually way exceeded expectations and went back to jumping or doing their job when the goal was just to get them comfortable enough to do some groundwork. So a lot to know or a lot to learn about that. We get asked a lot of questions too as well. If we do this surgery in 4 or 5 years, is the bone going to grow back and we'll be right back in the same situation? It's another question we don't know yet.
Right.
We've been able to look at some horses and CT some horses. We've done one about a year out. Dr. Janheim has done, I think, 2 or 3 horses. So the longest one maybe 3 years out. And there was pretty minimal bone regrowth, which is good. So we're hoping that either it doesn't come back much at all, or it takes a really long time to become a problem again. So.
Yeah, that's interesting to follow that up in the future. Do you have any recommendations for non-medical management strategies or rehab strategies for horses that have gone through the surgery to help them get back to some level of comfort?
Absolutely. So all of the horses, when we discharge them, we give them a long list of things to accomplish or to start doing. And one is, I think, that movement is very good for the horse. So if you have a horse that's neurologic, if you want to make it worse, put it in a stall and don't move. Now, there's obviously some caveats if they're going to fall on you or something like that. But the point is that just like people, if you're bedridden for a long time, your balance is poor when you get out. And that's because if you don't use some of these muscles, you lose some of the proprioceptive feelings you have for knowing where things are in space, and your coordination gets worse. And so, at least in my caseload, we usually give them after surgery a couple of days of stall rest. And then they get turned out in a small paddock. They start being hand walked. We increase the amount of hand walking, and we encourage them, as long as it's safe to do so, to go over ground pole, go up and down hills, go on and off different surfaces, walk on asphalt, walk off asphalt, do figure eights, do all the things that helps the horses know where their feet are and learn to be coordinated. I really think that a lot of problems in horses can be helped or prevented by increasing core strength and core exercises, and balance. And so I'm a real big believer in any of the band of products that you can use to help with core strength and peso training to get their head set. And so they're using their core muscles, as well as there's balance pads that you can buy that are also very good, of different sizes and different textures, so horses will have to work harder to balance themselves. And so we incorporate all of that into the rehab part of the program. The range of motion exercises, carrot stretches, all those sort of things that we want them to bend, move, and stretch. And I mean, it's very similar to what they tell us as we get older. You need to keep working and stay strong, but also stay flexible.
Right. Yeah. Those things can never really be harmful for the horse, no matter the condition anyway. So it sounds like just more of what's correct and proper muscling, proper balance.
It really makes a difference. And some horses too, we even had where they got in this program takes out about 6 weeks. So horses are usually after surgery, they're back on the saddle at 6 weeks after surgery, which is much quicker than a lot of other surgeries that we do. And as a matter of fact, I would say about 75% of the time I have clients calling me at 4 weeks and be like, they look so good. Can we start riding? Just give it a couple more weeks.
Right.
But I think that's a big part of it, is to try and get them, moving. And we've had some horses that at the 6 week time frame that they've gone back into work. And so people stopped all the other rehab parts of things, and the horses kind of regressed where they didn't do as well as we thought. And you say, hey, okay, are you still doing balance pads? Are you still doing these exercises? And they're like, oh, well, we stopped because we thought we were back to riding. It's like, start up again. And the horses responded well. So I think it's important, a very important part of the whole picture.
Yeah, that's a great point. Do you have anything else that you'd like to add on this topic before we wrap up today?
I don't think so. I think that, as far as the procedure, we've been very happy with the outcomes. We've got horses that have been doing 4 and 5 star eventing competitions that have gone back to that level. We've had all different vocations. We've had a horse that's raced again, a racehorse that had problems, that we did surgery in 2 sites and is back racing again. So been very pleased with the outcomes. And I think it's one of those things where I feel like even if the horse doesn't maybe get back to the level that people wanted at, we help their pain. And I think that's really important long term for these animals.
Yeah, I mean, it sounds like you've had great results, even just with the procedure being so new. And I can only imagine where it will go as you learn more, and especially about some of the long-term outcomes for these cases. So.
And we're getting more information, and one of the things is Jan-Hein Swagemakers has been so generous in teaching the procedure, and he had his first workshop in Germany, and he invited myself and John Janicek from Brazos Auto. He's another equine surgeon, so we went out to Germany together. I don't know if Floridian and Texan were good representatives of the U.S. and Germany, but we had a good time and learned a whole lot, and then started doing the surgery back here. And then since then, we've had, I think, 7 different wet labs for other surgeons, sponsored by Rewo Spine, who has been outstanding with helping us get this going. I really can't say enough good things about them and Dr. Swagemakers as far as helping us teach other surgeons. So now there's, I think, about 9 institutions now that offer the surgery around the country.
Oh, awesome.
So there's a couple places in Texas, there's a couple in California, in Pennsylvania, several here in Florida, there's one in Kentucky now. And so I think it's the more horses we're able to help, the more information we're going to get. And I think it's so common that we're going to have more information just by having more people offering the services. So.
Yeah, no, it's great that it's becoming more accessible to people around the country as well. So that's really promising. Well, thank you so much again for joining us. I've really appreciated getting to talk with you and learn more about this surgery.
Yeah, thanks a lot. I really appreciate you having me.
I want to say thank you again to Dr. Tull for joining us, and thank you to Equithrive for supporting this episode. And as always, thank you to our listeners for tuning into the podcast. If you have any questions or suggestions for the podcast, please send me an email at csisson@equinenetwork.com.